Hello, welcome to Adopt NCLEX and tonsillitis and its associated complication. There's three things they can ask you about this: the initial diagnosis of tonsillitis, tonsillar abscess, and what you do after you remove the tonsil. So let's get to it. A very commonly tested topic, very straightforward, and let's talk about it. So briefly, let me give you background about the tonsil. So if this is your mouth, okay, and your teeth is usually in front here. You have your teeth in front here like that. And this is your jaw, and this is the back side. So this is the back side going to the pharynx. In the middle, we have this is uvula is here, and the epiglottis is here, right behind it. And then near the uvula and the lateral side is this tissues here. This is the tonsil. There's two of them. And it's a highly vascular organ. That means he has a lot of blood vessels. So it's very vascular. He has a lot of blood vessels. Unfortunately, he can get infected. So infection. You can have infection and due to like virus or bacteria. So these are the two things that can cause it. Bacteria. What does it cause? Just a pharyngitis. It's a sore throat. It's a kind of sore throat. But this one, when you look at it, the tonsils is really, really inflamed. They look really inflamed. They look red. They look really red. Let me draw. They look like red. So I'll put the color red. They look inflamed in tonsillitis. These are all inflamed. It's not just sore throat that you get. You can see the tonsils, you start kissing each other. It will be, we call it kissing tonsils. That's bad. They get closer and closer and closer. So kissing of the tonsil is a form of tonsillectomy. And that's a problem that you got to pay attention to. And that is what makes this is different from a regular sore throat, because the tonsils start coming together and they obstruct the all airway. And so how would the patient present where they have pharyngitis, okay, sore throat? In addition to that, they will have fever, and because the tonsils are kissing, they will have, when they swallow, it's painful, dysphagia. Okay, and so that's what they present. Of course, this is, and most sore throat are caused by group A, sometimes group B, but this one is group A strep. It's a group A strep problem. And then because of the kissing, it causes patient uncomfortable. They can't swallow, they can't eat. Your treatment is usually, you just have to be supportive, okay? Supportive. And most of the time, antibiotic is okay because of the strep. They can get like penicillin, depending on their allergy, for like 7 to 10 days, and that should take care of it without any problem. So that's the management of that. It's a tonsil and tonsillitis. It's tonsil infection of the tonsil. That's what it means. If this doesn't resolve, very straightforward infection due to inflamed tonsil by the group A strep is more than just pharyngitis, sore throat. If it doesn't resolve, it turns into another problem. And so just having tonsillitis is never a problem. It's like any sore throat, but you need antibiotic. It will get better later on. But if it doesn't get better, you develop this what we call tonsillar abscess. So around the tonsil, you develop infection. There's abscess. There's pus over there. And that is more serious. Okay, that's more serious. Patient who had previous tonsillitis, if they come back and they have what we call, they sound muffled, which is hot potato sound. Their voice is like you can't hear them. Yeah, hot potato, hot potatoes, potato sound. Okay, that is hot potato sound. That's what we call muffled. We have muffled sound. That's bad. That's evidence of tonsillar abscess. And then they won't be able to open their mouth. Their jaw will be tight. It's like the inflammation affects the jaw, the muscle of the jaw. We call it trismus. They can't open it. Trismus is bad. Okay, they can't open their mouth, so they can't open their mouth. Because they can't open their mouth, what do you think? If there's saliva in your mouth, you make saliva no matter what. You can't open your mouth, then the saliva will just drain along the cheek, and so we call it drooling. You have the drooling of the saliva, and at the back initially when I draw for you, I draw the uvula is here and the tonsil is here. The uvula doesn't like to be bordered, and so usually it's straight in the middle. When you have tonsillitis here, the uvula said, no, I'm moving away. So uvula will move towards here like that, away from the infection, if this is the infection. So we call it deviation of the uvula. So the uvula will deviate away from where the infection is. So deviation uvula, away from the infection. So that's what it will do. These symptoms are classic for peritonsillar abscess: hot potato sound, muffled sound, trismus, can't open their mouth, they are drilling, and they have deviation of the what do they call the uvula. So they have deviation of the uvula. That is the key for evidence of tonsillar abscess. So how you drain it is the treatment of abscess. How do you treat abscess? Usually you drain it, okay? Drain the abscess and they give them antibiotic. Most of the time they aspirate, they take them and they put a needle through the abscess and they aspirate, and then we treat them with the antibiotic. Because the tonsils will be kissing each other and they close on top of the uvula, your main treatment is maintain their airway. This is an airway problem, okay? Airway problem. So if they give you, who do you see? The patient has evidence of peritonsillar abscess, not just a tonsillitis. They will have peritonsillar abscess, which present like muffled sound, trismus, and drooling. You should see that patient first because that is an airway issue. So once again, they have to have evidence of abscess presenting like hot potato sound, trismus, drooling, and the deviation of the uvula away from the infection. That is a priority patient that should be seen because that's an airway problem. Very, very important. I'll try to give you good information. You don't have to know too much. This is the key things you have to know. That is what they like. They're going to test you. It's an airway. How do you treat it? How do you manage it? How do you present? And how do you distinguish it from just normal tonsillitis? So the last one is now we've developed the tonsil, and now we've developed abscess. We remove it. We have drained the abscess. Well, nobody wants to have the same symptoms again. So usually the doctor will recommend removal of the tonsils and the adenoid. So you undergo tonsillectomy. Okay, removal of the tonsil. So you just remove the tonsil. It's a surgery that they do. They remove it, I told you it's a very, very vascular organ. So they can be bleeding. So post-op, your treatment is mostly, post-op care is to treatment after surgery. Prevent hemorrhage. Prevent hemorrhage as much as possible because they can bleed. When you remove the tonsil, the bed where the tonsil is laying have a lot of vessels that has been cauterized, basically destroy them, but they can also bleed. So you want the wound bed, okay, the wound bed to be dry and prevent bleeding. So most of your precaution will prevent the wound bed from bleeding. Okay, so you got to tell them certain things. Okay, don't irritate that area. Okay, don't irritate that area. I call it the 3 C's. There's more, but 3 C's are the few of them to remember some of the key. Usually I try to put words together so that you can have 3 main symptoms, the rest you can make it up. So 3 C's, don't clear. So clearing of throat. Don't do that. Or you say, don't 3C, okay? Clearing throat. You shouldn't do that. They shouldn't do that. No coughing. And the last C is usually they shouldn't, the last C is no contact sports. Usually 14 days. You cannot play basketball. You cannot play football. No contact sports at all. Nothing. You can do that. Okay, they can do that at all. No contact sports. So no clearing of their throat, no coughing, no contact sports are the 3 main precaution you tell them that you shouldn't clear your throat, don't coughing, and then so that the wound bed can dry and they don't cause infection and bleeding as number 1. So what do you tell them? How would you know based on this that they have what we call bleeding? So signs of bleeding. Signs of bleeding. They're going to be doing this. If you told them not to clear their throat, if you tell them not to cough, if you tell them not to do contact sports, because when they do that, they're going to bleed. If they're bleeding, guess what? That's what they will be doing when they come in. They will show you signs that that's what, if there's bleeding, they will tend to these things. So they will have frequent swallowing. They will be swallowing a lot because they're trying to clear their throat. So they will swallow to clean everything out. They will be clearing their throat that you told them not to do because there's blood there. And they will vomit blood. But the key sign is frequent swallowing in the patient who has tonsillectomy is number 1 sign that they're bleeding. Or clearing of throat is number 2 sign before even you see blood. Frequent swallowing, clearing of throat, number 2 signs, and before they start vomiting. Of course, they're going to get pale, so they'll get, okay, and the blood pressure will go down, BP, but this is late finding, okay, or there will be the heart rate up, urine output down, all those things. But usually before you get to this stage, it's too late. You want to catch them when they frequent swallowing or they clearing their throat. So who do you see first? They will give you a tonsillectomy patient. They have their tonsil removed. All of a sudden, what they are doing, they clearing their throat or they have frequent swallowing. That patient need to be seen because it's hemorrhage. They're going to shock. If you listen to my B sharp thing, this is one of them. Hemorrhage. They won't tell you patient is hemorrhaging, but they will tell you patient is clearing their throat or they have frequent swallowing. And that is the sign of hemorrhage. So you tell them, don't do 3Cs to prevent hemorrhage. But if they're hemorrhaging, you should be looking for those 3 C's. You see how you can use the same thing, risk factor and teaching, and then intervention and signs and symptoms. Like I told you, they are interconnected. This is your precaution, clearing of throat, coughing, and contact spots. Therefore, if they come in and they're clearing their throat and they're coughing, I know that they're bleeding. And the last thing is, who do you see if somebody have tonsillectomy? Okay, tonsillectomy, and they tell you, the mother tell you, okay, tonsillectomy. Mother said, class, contact sports in 11 days, between 1 to 14 days, it's still a priority patient because they're going to bleed. So that patient need to be seen. If you have tonsillectomy, you have contact spots between 1 to 14 days, it's a priority patient that I need to see. Who do you see first? This patient need to be seen because they are not doing what you're telling them. They are risks of bleeding. The only time they have contact spots if it's when it's more than 14 days. So once again, who do you see first? Tonsillectomy patient who is having contact spots within 14 days need to be seen. They should not do that. That's bad because they're going to bleed. Once again, this is all I have for you. Very quick information. Take care of yourself and have a good day.